Your heart could be in serious trouble right now, and the first warning sign isn't in your chest. It's 26 inches lower. It's in your feet. I know that sounds strange. Your feet and your heart seem completely disconnected. One pumps blood, the other walks you to the mailbox. But here's what most people over 60 don't realize. Your feet are the farthest point from your heart. They're at the end of the line, which means when your cardiovascular system starts struggling, when those arteries begin narrowing, when that pump starts weakening, your feet feel it first, not your chest, your feet. And today, I'm going to show you exactly what to look for. 7 specific signs your feet might be sending you right now. Signs that could indicate serious cardiovascular problems developing silently inside your body. Some of these you can check in the next 30 seconds. Others you've probably noticed but dismissed as normal aging. They're not normal. They're signals. Now, before we dive in, let me share something that honestly concerned me when I first came across it. According to data from the National Health and Nutrition Examination Survey, peripheral artery disease affects about 12% of adults over 60. But by the time you hit 80, that number jumps to over 23%. And here's the part that should make everyone pay attention. The CDC reports that people with PAD have a risk of heart attack or stroke that is 5 times greater than those without it. 5 times. Your feet aren't just telling you about your feet. They're telling you about your heart, your brain, your entire circulatory system. The same plaque building up in the arteries of your legs is building up everywhere else too. So let's go through these 7 signs, and I want you to actually look at your feet while we do this. Sign number 1, swelling that won't quit. Look at your ankles right now. Are they puffy? Do your socks leave deep indentations when you take them off at night? Here's what's actually happening inside your body. When your heart muscle can't pump blood efficiently, that blood starts backing up in your veins. Fluid leaks into your tissues, and because of gravity, it pools in the lowest point, your feet and ankles. Research from the multi-ethnic study of atherosclerosis found that 28% of community-dwelling adults had pedal edema, and studies confirm that swelling in the feet is often the first sign of heart failure for many people. Now, I want to be clear about something. Not all swelling means heart problems. Pregnancy causes it. Standing too long causes it. Too much salt causes it. But if your swelling is persistent, if it comes back day after day, if you're pressing on your ankle and the indentation stays there for several seconds, that's called pitting edema, and that needs medical attention. Sign number 2, your leg hair is disappearing. This one catches people off guard. You might think losing leg hair is just aging. Maybe you haven't had to shave your legs in months and figured, great, one less thing to do. But here's the mechanism. Hair follicles need blood to grow. They need oxygen and nutrients delivered constantly. When your arteries narrow and blood flow decreases, your hair follicles are among the first casualties. They simply stop producing. And here's what really got my attention. The CDC reports that up to 40% of people with peripheral artery disease don't experience any leg pain at all. No numbness, no obvious symptoms. Instead, they notice their leg hair thinning or disappearing entirely. It can be the first and sometimes only visible symptom. Check your shins. Check your feet. Compare them to photos from a few years ago if you have them. Hair loss on your lower legs, especially if it's more pronounced on one leg than the other, deserves a conversation with your doctor. Sign number 3, cold feet that never warm up. Now, everyone gets cold feet sometimes, but there's a difference between cold feet because you forgot your socks and cold feet because blood isn't reaching them properly. When arteries narrow or become blocked, less warm blood reaches your extremities. Your feet might feel cold, even when the rest of you is comfortable. They might look pale or slightly blue. Medical research confirms that cold extremities can be an early warning of cardiovascular disease. Blocked arteries, heart failure, or irregular heart rhythms can all restrict blood flow to your feet. Here's a quick test. Touch your feet, then touch your thigh. Is there a dramatic temperature difference? Are your toes consistently cold while the rest of your leg feels normal? That gradient matters. Sign number 4. Changes in your toenails. When was the last time you really looked at your toenails? I mean, really examined them? Healthy toenails grow steadily. They're pinkish because of the capillaries underneath delivering blood. But when circulation decreases, nails don't get the oxygen and nutrients they need. They become thick, brittle. They might turn yellowish or grayish. They grow slowly or stop growing altogether. And this isn't just observation. A published study examined over 100 participants and found that nail deformity, what doctors call onychodystrophy, was significantly associated with abnormal blood flow measurements. The researchers concluded that nail changes may be an early marker for detecting circulation problems before other symptoms appear. So, if you've been blaming thick, ridged, discolored toenails on fungus or aging, it might be worth getting your circulation checked. Now, let's pause here for a moment. I want to be straight with you about something. I'm sharing this information because I genuinely believe awareness saves lives. But I'm not a doctor, and neither is this video. What I'm giving you are signs to watch for, signals that warrant a real medical evaluation. Some of these signs have multiple possible causes. Swelling can be kidneys, cold feet can be thyroid, nail changes can be fungus. The point isn't to diagnose yourself from your couch. The point is to stop ignoring what your body is telling you and have an informed conversation with someone who can actually run the tests. Okay, let's continue. Sign number 5. Skin changes on your feet and lower legs. This one is visual, and once you know what to look for, it's hard to miss. Poor circulation affects your skin in specific ways. It might become shiny and tight, dry and flaky in ways that lotion doesn't fix. The color might change, becoming pale when you elevate your legs, then turning reddish or purplish when they hang down. Research shows that discoloration in the feet, particularly a bluish tint, indicates that insufficient oxygen is reaching the tissues. Some people develop small patches of redness or notice that their skin looks thin and fragile on their lower legs and feet. Compare the skin on your feet to the skin on your arms. Same texture, same thickness, same color. Differences might be meaningful. Sign number 6. A weak or missing pulse in your foot. This is one you can actually check yourself right now. And honestly, this surprised me when I learned you could do this at home. There are 2 main pulses in your foot. The dorsalis pedis, which sits on top of your foot, roughly along a line between your big toe and second toe, and the posterior tibial, which is behind your inner ankle bone. Here's how to check. Use 2 or 3 fingers, not your thumb, because your thumb has its own pulse that can confuse things. Press lightly on the top of your foot, starting between your big toe and second toe, then move slowly toward your ankle until you feel a gentle thumping. If you feel a strong, steady pulse, that's good blood flow. If it's weak, thready, or you can't find it at all, that could indicate narrowed or blocked arteries. Now, about 10% of people have naturally absent dorsalis pedis pulses due to anatomy, so don't panic. But if you consistently can't find pulses in either location on one or both feet, that's information worth sharing with your doctor. Sign number 7. Wounds that won't heal. This is the one that scares doctors the most, and for good reason. Your body heals by sending blood to damaged tissue. Blood carries the oxygen, nutrients, and immune cells needed for repair. When circulation is compromised, that healing process slows dramatically or stops entirely. A small cut on your foot that should heal in a week might still be there a month later. A blister becomes a chronic wound. A minor scrape turns into an ulcer. Studies confirm that non-healing wounds, particularly on the feet and lower legs, can indicate serious vascular problems, and these wounds left untreated can become infected, potentially leading to severe complications, including amputation. If you have any wound on your foot or lower leg that hasn't healed in 2 to 3 weeks, please get it evaluated. So now you know the 7 signs. But what do you actually do with this information? First, the test you should know about. It's called the ankle-brachial index, or ABI. It takes about 10 minutes, it's completely painless, and it compares the blood pressure in your ankle to the blood pressure in your arm. If those numbers are significantly different, it indicates blockages in your leg arteries. Research published in major cardiology journals found that a low ABI doubled the 10-year mortality risk and heart attack risk across all patient categories. This is a simple, non-invasive test that can reveal serious problems before they become emergencies. If you're over 60 and have any of the signs we discussed, ask your doctor about getting an ABI test. Second, understand that what's happening in your feet is happening everywhere. The same atherosclerosis, the same plaque buildup, the same narrowing, it's not limited to your legs. Studies show that patients over 50 with peripheral artery disease have a 68% incidence of coexisting coronary artery disease. Your feet are a window into your entire cardiovascular system. Third, most of these conditions are manageable when caught early. Lifestyle changes matter. Quitting smoking, controlling blood pressure, managing blood sugar, getting regular exercise, these interventions actually work. Medications help. In some cases, procedures can open blocked arteries and restore blood flow. But you can't treat what you don't know about. Your feet have been trying to tell you something. Maybe for months, maybe for years. The question is whether you'll listen. Look at your feet tonight. Really look at them. Check for swelling. Notice your skin. Examine your toenails. Feel for your pulse. Compare both feet to each other. And if anything concerns you, anything at all, make that appointment. Get that conversation started. Your heart is worth it. If this information helped you, share it with someone you care about. Someone over 60 who might be ignoring what their feet are telling them. And stay tuned for more videos where we decode what your body is really saying. I'll see you in the next one.